Due to seating limitations in the Einstein Lab, this informal meeting workshop portion of our meeting can be viewed via VBTV Channel 47 or via live streaming at watchlivevbschools.com or via Zoom, period. It is the school board's protocol to break at 5:30 to prepare for the regular school board meeting to begin at 6 p.m. At 5:30, the board will conclude this meeting unless my colleagues vote to continue the informal meeting until 5:45. The informal session will conclude no later than then to allow the school board and the school administration to prepare for the regular school board meeting at 6 p.m. So with that, Madam Clerk, would you please announce those school board members in attendance?
Thank you, Madam Chair. Attending in the Einstein Lab is Chairwoman Rye, Ms. Anderson, Ms. Hughes, Ms. Manning, Ms. Felton, and Ms. Owens. And presently attending via Zoom is Ms. Weems and Ms. Franklin.
Okay, and those two colleagues are absent due to health reasons, and we have Mrs. Melnick working on technical difficulties, also health reasons, and Dr. Robertson is here today in Dr. Spence's stead, who also is absent due to health reasons. And we have Mrs. Riggs on the way. So thank you. So to start things off with school.
I think I hear someone.
Yeah.
Is that Ms. Melnick? Oh, she's
Okay.
Okay, good. So we have our three remote participants all with us. Thank you. So with starting things off, I said I would reference an email I sent last night. So just want to touch briefly on this because you know we have important matters to cover in this 2-hour workshop. So speaking to the subject of school board decorum, we want to emphasize our two goals. The business of the school division is able to be conducted, and we want to allow citizens to be heard. So what I've shared with everyone is, again, to reiterate that with regard to speakers, if a speaker this evening exceeds his or her time limit or speaking off topic, I will gavel the individual to indicate either their time is up or ask them to stick to the formal agenda topic. If they fail to comply, a Safe Schools coordinator will approach the speaker and ask that they return to their seat or they can leave chambers. And if they still fail to comply, I will gavel again, noting them as out of order, and we will ask one of our police department detectives to approach and direct the individual to leave. In that case, we'll need the officer to get the contact information from the individual. And basically, similar with regard to standing rules, if someone is standing in chambers, a Safe Schools coordinator will approach and just respectfully ask them to be seated. If they fail to comply, I will, between speakers, remind that standing in chambers is not allowed, and if someone needs to stand, they can depart the room briefly. And again, if they fail to comply, a Safe Schools coordinator will have a police officer at that point approach and direct the individual to sit or leave chambers. And finally, with regard to items brought into the meeting, all items are treated equally. If someone is displaying any items, whether it be posters, props, or flags, in a manner in violation of School Board Bylaw 148, then again, a Safe Schools coordinator will approach and remind the individual of our decorum rules. If they don't comply, they'll be gavelled, and the individual again asked to comply with the rules of decorum. And if still no compliance, a coordinator will have an officer approach and ask the individual to cease the disruptive action. If the person is asked to leave, the officer would get contact information as noted above. Again, a reminder of the purpose of Bylaw 148 is to avoid disruption and to guarantee safety and a path of sight for members present. So, I remain hopeful that we have a lot of really important business tonight. A lot of the public is tuning in. We have a number who've elected to speak, so I really don't want to spend any more time at this point, so unless there are questions. Yes?
Yeah, I have a couple of questions. At the last meeting, we kind of changed protocol with telling all the speakers that they had to stand out of the hallway. So we have
Oh, I'm sorry, I
we
left
have
that
a
out.
bunch of speakers. I don't think it's fair to make them
We're
stand
gonna-
like
they're-
the last meeting.
Yes, our clerk is going to call 3 at a time.
Okay, thank you.
Thank you for
And then I'm
noting
curious as to how we're going to determine what is an agenda item because, for example, 2021-22 reopening plan is very, very, very broad,
Right, and the
the
I
citizens
recognize
have
that.
not.
Mhm.
They don't know until we get this briefing because we don't even know what is going to be discussed. So how are you going to determine what's an agenda item?
I mean, it's no different than any other time, right?
Well, we typically get more information in our agenda packets, and the public typically gets more information on what's going to happen, and we haven't gotten anything for this meeting.
It is acknowledged, and I
Okay.
thought I tried to do some email last night. The reopening is a very broad topic, so there'll be every indulgence granted that falls within reason. Is my
Okay, and
best
I
answer to that.
appreciate you giving some
Mhm.
latitude on that. And then just my last thing, we're saying everything that you can't do, people. What are we gonna do to welcome people into our meeting and make them feel welcome to be here? Because we are their employee, their employer,
Are
or
you-
their employee,
are
we are
you-
their employee.
Our usual introduction to the speaker portion of the agenda, there's
Well,
a na-
usually
there's
that's been a
narrative.
whole 2 pages of rules of what
Yeah.
they can't do, instead of welcoming
Yeah.
them and welcoming their input.
Well, and again, I plan to begin like I did this evening to reiterate what I believe is a goal we all share, what our purpose is this evening, and that I believe everybody can rise to the occasion so that we can accomplish our goals.
And kind of piggyback, I will tell you, the week after our last meeting, I had the pleasure of attending a Chesapeake School Board meeting. That chair started public comment with, "We appreciate the public coming out. We know you're here because you care." Ours does start out with a list of what you cannot do, and it kind of sets the tone. And it seems like every bylaw, every rule that we make kind of makes it more and more and more narrow, and it's just not appropriate. As far
So I
as
appreciate that, but you also hopefully understand, because of challenges, why we have to make clear what is within our authority to do. But it's a good thing to keep in mind, and I will do so.
well, everything is about you can't, as opposed to we actually appreciate you. These parents and grandparents show up because they do care, they are interested. Some of them disagree with me, some of them disagree with you, and that's fine.
And that's the tone I try to convey in my email responses on behalf of the school board. So certainly it'll be kept in mind for the actual in-person
Can I go
meeting.
and finish? It's really not conveyed from the dais, and it really should be conveyed better. That's just really a problematic thing. And I also don't have a problem with, you started out saying people need to keep to 4 minutes. That's not a problem. Everybody has that amount of time. And it's not a problem to say we don't allow people to stand. That's always happened. But 4 minutes is fine if we haven't interrupted them. That actually is what drags things on a lot. And I also was going to mention that we haven't really gotten any supporting materials for the agenda. So it would be hard for some of these, and you're right, they're very broad. That they should be broad if none of this is being narrowed down and we're not getting any supporting documentation. And the last part of what you mentioned about people bringing things in, people are not supposed to be waving things around, and that's fine, but you can't decide at the front door that's what they're gonna do. And it was my understanding, I was told this, I don't know how it, all came about, that our attorney said that, people couldn't bring certain things in. One is, I do not think that we can predetermine that somebody's gonna wave something around. But secondly, the school board attorney doesn't make policy. She interprets things for us and she makes recommendations, and when we set policies, she checks it for legal sufficiency. But ultimately, it's us that set the policy. And so that just shouldn't be happening anymore.
And it was reassessed, and it was not brought to the attention of the school board until 2 days ago. The meeting was July 20th, and so based on the reassessment, and at the time, I think the decision was made by staff in the moment that they felt was a reasonable interpretation of the bylaw. I asked for a reassessment, and we made clear tonight that all objects will be treated the same. Thank you. All right then, are we ready to go ahead with our item B, our reopening plan?
Well, can we bring up other admin matters?
Oh, please.
As far as the supporting documentation for the agenda, we used to get that on Thursdays, and so I'm trying to find out what the process is. I mean, I know that we've set a deadline for any of us to send to the chair and vice chair if we want to have it added, and that's fine. I mean, we need to know what that is ahead of time. But what is the deadline that y'all finalize and make it available to us? Because we still don't really have much of anything. And I think that our meetings would actually be more efficient knowing ahead. There might be things we research ahead of time, ask questions ahead of time, gives the public an idea to narrow down exactly what we're talking about. But we don't have anything.
Dr. Robertson, would you like to
So
respond?
could I get some clarification of what items that you feel like you should have received on Thursday when the agenda materials were shared?
Well, if all of this is supporting documentation,
Yeah.
could we have not had this before so that we could look it over and
Yeah,
formulate questions?
Yeah, and so that's a good question. So I will tell you that in this particular presentation, we were working on this all the way until this afternoon, at probably 12 o'clock, trying to make sure we're making our decisions and recommendations based upon the most recent evidence. One of the last pieces that we received today was a FAQ from our insurance provider based upon our decisions. And that didn't come in. I can look at my email, but I believe that was an email we received after 12 o'clock today. So normally we try to have those things to you as soon as possible, but to ensure that you're getting the most up-to-date and accurate information, we will work on the workshops in particular up until the last particular moment. The information items we try to have the day before to be able to get to you. But that's certainly if the board feels that you need a hard deadline earlier, we can send you what we have earlier, recognizing that some of that information could change.
It would be good to have a hard deadline for getting information. And to me, it's not a huge, big deal if once in a while, I mean, this is quite a lot of things, but if one of them is still being worked on, to make the announcement, this one particular topic, we're still waiting on information, it won't be available, until later, but it seems like most of it we should be able to get. I mean, there's a reason that we're making our request by a certain time is to make sure that we can prepare. So it would be good to be able to prepare and be able to read all of this.
And if I could just piggyback on that, the first couple of years I was on the board, we did get all of our documents in advance, and I felt much more prepared for the meetings. And, there are probably questions that maybe I wouldn't need to ask if I had prepared in advance and knew, a little more details about what we would be talking about, and I could do research on my own before the meeting. And I think that might be one of the reasons why our meetings are lasting so long is because we just, we come in here, we don't have any of this. And so we're seeing it for the very first time, so it's a lot to take in. Thank you for
But
bringing
we'll certainly take the direction from the board.
Anybody else? Thank you. And anybody else? Okay, so with that, I think I will turn it over to Dr. Robertson to
Yes.
introduce this
So-
first session.
We have several people join us tonight. Mr. Freeman is going to kick off this presentation. He'll be followed by Dr. Saltner and then Dr. Rogers and then concluding with Dr. Jabari from the Health Department. And so, Mr. Freeman, take it away.
I'm not going to try this without my glasses. All right, good afternoon, Chairwoman Rye, Vice Chair Melnick, members of the board, and good afternoon to our students, families, staff, and community members. who are viewing this remotely. My name is Jack Freeman. I'm the Chief Operations Officer for the school division, and it is my pleasure to present to you the recommended plan for beginning this school year. This plan was developed collaboratively with the support of our tremendous leadership team under the guidance of Dr. Spence, and was informed by all that we learned responding to COVID-19 over the last year and a half. After the first portion of the brief, Dr. Gene Saltner and Dr. Kip Rogers will also share some specifics regarding the Department of School Leadership and Department of Teaching and Learning. At the conclusion of the brief, Dr. Jabari, the Chief Deputy Commissioner for Public Health Preparedness with the Virginia Department of Health, will also share some information and be available to take your questions. As we shared with you for months, Virginia Beach City Public Schools is committed to 5 days of in-person learning, fully virtual and fully in-person learning options, and offering a range of extracurricular activities in high schools and middle schools. When developing this plan, we leveraged recent legislation and guidance from recognized bodies of experts whose roles are to ensure public health and also to support health, safety in schools. It is worth emphasizing that the guidance and recommendations from these bodies are in alignment. These resources include Virginia Senate Bill 1303, which was put into law last March, CDC guidance for COVID-19 prevention in K-12 schools, Virginia Department of Health and Virginia Department of Education interim guidance for COVID-19 prevention in Virginia pre-K through 12 schools, American Academy of Pediatrics COVID-19 guidance for safe schools, and expectations set by Governor Northam at his press conference last Thursday. Here are some of his quotes. We expect them, and he was referring to school divisions, to follow the law. And the law that was passed earlier this year, and he was referring to Senate Bill 1303, says that schools will do 2 things this fall. They will offer in-person instruction 5 days a week, and they will follow CDC mitigation strategies. He further stated that the CDC guidance is that people in schools need to be wearing masks. And the CDC guidelines, which we've tried to follow all along, say that children in school, K through 12, should have masks on. And this is the language in the law that he was referring to. Each school board shall offer in-person instruction to each student enrolled in the local school division. For the purposes of this act, each school board shall, 1, adopt, implement, and when appropriate, update specific parameters for the provision of in-person instruction, and 2, provide such in-person instruction in a manner which adheres to the maximum extent practicable, to any currently applicable mitigation strategies for early childhood care and education programs in elementary and secondary schools to reduce the transmission of COVID-19 that have been provided by the Federal Centers for Disease Control and Prevention. So school divisions are legally obligated to adhere to CDC guidance to the maximum extent practicable. Let's look at some of the key takeaways from CDC's guidance. Safely returning to in-person instruction is a priority. Vaccination is currently the leading public health prevention strategy. Regarding masking, CDC recommends universal indoor masking for all teachers, staff, students, and visitors to K through 12 schools, regardless of vaccination status. Children should return to full-time in-person learning in the fall with layered prevention strategies in place. Maintain 3 feet of distancing for students when possible, combined with mask wearing. When possible means that getting students back to in-person learning is the priority. Distancing should support that goal, not restrict it. Those are considered the 3 key prevention strategies, but layering other strategies further reduces risk. Other important layers to consider are screening testing, ventilation, hand washing and respiratory etiquette, staying home when sick, COVID testing, contact tracing, and cleaning and disinfecting. To guide decisions on the level of layered mitigation strategy, the CDC guidance further recommends monitoring community transmission, vaccination coverage, screening testing, and occurrence of outbreaks. We're going to come back to this topic, but before I do that, in the opening slides, I shared that we referenced guidance from several recognized public health bodies and noted that the guidance and recommendations were in alignment. Here's an example of what that means. The first quote is from the CDC, and I shared it on the previous slide. CDC recommends universal indoor masking for all teachers, staff, students, and visitors to K through 12 schools, regardless of vaccination status. Next is the American Academy of Pediatrics. All students older than 2 years and all school staff should wear face masks at school unless medical or developmental conditions prohibit use. And then Virginia Department of Health. All K through 12 schools, including pre-K classrooms in Virginia, should implement a requirement for students, teachers, and staff to wear masks indoors regardless of vaccination status. The recommendations are aligned. The top bullet here is one of the key takeaways from CDC guidance. I told you I'd come back to it. To guide decisions on the level of layered prevention strategies, localities should monitor community transmission, vaccination coverage, screening testing, and occurrence of outbreaks. There are 2 measures that are recommended to monitor the level of community transmission. Our localities, so Virginia Beach's, total number of new cases per 100,000 persons in the past 7 days, and the percentage of nucleic acid amplification tests that are positive in the last 7 days. Those indicators are on the left of the chart that you see here, and I want to emphasize that the CDC recommends using these measures for the locality as a whole, meaning the city of Virginia Beach, and not for schools or school divisions themselves. This is also different from last year's recommendation to use Eastern Region data. We will be using Virginia Beach data this year. The CDC recommends using these metrics to inform decisions on layered prevention strategies. Worth repeating, these metrics inform layered prevention strategies, not decisions to close schools, which is very different from last year. Across the top of the chart are levels of transmission: low, moderate, substantial, and high. Total new cases in the city of Virginia Beach in the past 7 days, the top line, is 114 per 100,000, which is in the high category. Percent positivity in Virginia Beach for the last 7 days, the bottom line, is 9.7%, which is at the top end of the substantial category. Both of these metrics have been trending up since early July. The CDC also recommends monitoring vaccination rates. A high vaccination rate is a positive indicator for decisions related to relaxing layered prevention strategies. In Virginia Beach, the current vaccination rate for those 18 and older is 56%, and the current percentage of eligible population between ages 12 to 17 is 36%. As a reminder, students younger than age 12 are not currently eligible to receive the vaccine. Knowing that we are in the substantial and high levels of community transmission, knowing that vaccination percentages are low, and taking into account the law and guidance recognized from public health bodies, we recommend the following strategy. Begin the school year with significant layers of mitigation while accomplishing the primary goal of getting students safely back to 5 days of in-person instruction. Monitor community metrics, monitor community vaccination coverage, and monitor our contact tracing metrics. Collaborate with the Virginia Beach Department of Public Health to address outbreaks when they occur to minimize impact. When conditions permit, coordinate with Virginia Beach Department of Public Health to remove 1 layer of mitigation at a time and monitor that change for a minimum of 3 weeks. Before removing any layers of mitigation, they will be in accordance with the law, changes align with CDC guidance, and decisions will be in consultation with Virginia Beach Department of Public Health using up-to-date data and information. So that's the recommended strategy. So how do we recommend implementing that strategy to align with CDC recommendations in accordance with state law? We previously committed that we will be providing 5 days of in-person learning. We will continue collaborating with Virginia Beach Department of Public Health to provide access to the vaccine. We have hosted 2 cycles of vaccination clinics, one in the May through June timeframe when every high school hosted a clinic to support their assigned students and staff. And one cycle that concluded last week where 4 schools hosted clinics that served students, staff, and families across the division. We will continue this collaboration with Virginia Beach Department of Public Health to provide improved access to the vaccine. We recommend that masks be required for all who enter our buildings and travel in school board buses and vehicles, and that masks are not required outdoors. We recommend that students be distanced by 3 feet where possible. Getting students back to 5 days of in-person learning is the priority. Sometimes 3 feet will not be possible. We will continue our efforts to support ventilation. Routine maintenance enables systems to function as designed. When conditions permit, windows can be opened to increase ventilation. And we are in the process of obtaining portable HEPA units with UVC capability for classrooms and clinics. Similar to last year, we will encourage the daily use of this self-screening tool. The message, stay at home when you're sick. We recommend continuing our contact tracing, quarantining, and isolation plan. We intend to continue conducting contact tracing and communicating those results when cases are identified in our buildings. Updated contact tracing standards account for the effectiveness of vaccination and masks for our students. Under new standards, when what I'll call student A is identified to be within 3 to 6 feet of an infected student, call them student B, and they're both wearing masks, then student A will not be considered a close contact. As you recall, the standard is less than 6 feet for greater than 15 minutes in a 24-hour period, which equates to close contact and the associated quarantine. With masks, students can be as close as 3 feet and not considered a close contact. This exception only applies to students, not teachers, staff, or other adults in the K through 12 setting. Further, if anyone who is vaccinated and is asymptomatic, they will not be required to quarantine. Those 2 changes show the significance of the vaccine and the combination of mask wearing and physical distancing. Those who are vaccinated and those students who wear masks and distance greater than 3 feet will be much less likely to experience disruption to their schoolwork, extracurriculars, and athletics. For example, students who play sports and who are vaccinated will be less likely to miss a practice or game than a student who is unvaccinated. Moving on, we recommend returning to routine cleaning protocols and using enhanced cleaning protocols only when needed in consultation with Virginia Beach Department of Public Health to address specific problem areas. The CDC guidance states, in general, cleaning once a day is usually enough to sufficiently remove potential virus that may be on surface. We will encourage good hand hygiene and respiratory etiquette. Hand sanitizer will be provided in classrooms and office spaces similar to last year. We recommend school buses transport students with no COVID capacity limitations in order to achieve the primary goal of returning students to in-person learning. When conditions permit, windows will be positioned to improve ventilation, and we will use seating charts to support contact tracing. Personal protective equipment has been a topic of conversation. We intend to provide disposable masks at our schools and on school buses for those who forgot to bring a mask. Gowns, face shields, and other PPE will be available as required to support special education. And alternatives to masks continue to be evaluated for special circumstances. For example, we tried using the clear face mask last year. Those are the ones that you tended to be able to see through and cover the mouth. We also tried hoods that had the same effect of being, ideally being able to see the mouth. And we received poor reviews. They fog up, and they don't serve their intended purpose when they fog up. This year, all things considered, we're exploring face shields to support reading and language instruction. Last year, given all that was known and the distancing challenges that we were having in schools, we used plexiglass as part of our layered mitigation strategy. There is no data to support the effectiveness of plexiglass, and none of the guidance recommends it as a prevention layer. Therefore, it will not be part of our layered prevention strategy this year. We intend to collect unused plexiglass from our schools and buildings, and that being said, we will support local schools and office decisions to retain plexiglass that is already in place. We intend to physically distance to the greatest extent possible in our cafeterias, and seats will be assigned when feasible to support contact tracing. For example, in elementary and middle schools, it's feasible. In high schools, it is not. We recommend fielding varsity, junior varsity, and middle school sports teams with no COVID limitations on team size. We recommend allowing performing arts comparable to athletics and allowing a full spectrum of extracurriculars. In accordance with the strategy to implement significant layers of prevention to start the year, we recommend against using volunteers to start the school year. But we do recommend that we allow scheduled visitors. As an example, short visits for parents and students to elementary school classrooms prior to the start of the school year will enable a smoother transition for our elementary school students back into the classroom. We further recommend curricular work experiences and community-based instruction be permitted with mitigations in place, and that field trips be virtual only to start the year. One last topic before I turn it over to Dr. Saltner. Much of what has been described is directly related to schools, and our minds naturally gravitate towards the impact on schools. Our plan considers our whole population, all employees, all buildings. As described earlier, our community transmission is high now, and it's trending up. Our recommendation applies broadly to the division as a whole. Therefore, we recommend that masks be required for all who enter Virginia Beach City Public School buildings starting Monday, August 16th. I know that you all have many questions, and we will be happy to take them at the conclusion of the brief, but now I would like to invite Dr. Saltner to the podium to share some topics from school leadership.
Chairwoman Rye, Vice Chair Melnick, school board members, Dr. Robertson, I'd like to get right down to telling you the good things that are going on in preparation for the opening of school. On August 23, we're looking forward to welcoming 330 and counting new teachers, who include teachers who are new to teaching, experienced but new to Virginia Beach, and some returning Virginia Beach teachers who were hired after this orientation last year. They've been invited but are not required to attend. The content of this orientation focuses on introducing teachers to the specific curriculum and the expectations of the teaching and learning framework, which include foundational pieces of effective instruction, planning, teaching, assessing, and responding, and a positive and supporting learning environment built on relationships and attention to social emotional learning. In addition, the use of technology is modeled throughout, and teachers are introduced to the technology applications and resources relevant to their teaching assignments. At our next board meeting, we'll share with you school-level plans for Teacher in Service Week. But for now, let's take a look at what our students are doing with extracurricular activities. Our high school student activities programs are in full swing, with Virginia High School League sanctioned activities launching their first practice July 26th with golf. If you look at the screen, you'll see the start dates for all of our fall sports, as well as dates for our first competitions. While varsity sports are open to all grade levels only grades 9 through 11 are able to participate in junior varsity sports. And although masks are not required for coaches or athletes outdoors, indoors, all coaches, athletes, and spectators must wear masks. Athletes participating indoors when engaged in activity may relax their masks. Spectators will be permitted with certain restrictions, including social distancing. And again, this year, streaming services will be available for select events. Know that the Office of Student Leadership is closely monitoring student health. Daily, our coaches are proactively tracking all absences to identify early any COVID-related illnesses. We've also got our marching bands poised to practice. In fact, marching bands begin their first practice tomorrow in preparation for performing for their home football games and competitions. Orchestra, choral, band ensembles, as well as theater performances are slated to return with the start of the school year. And performances will be permitted with social distancing and some restricted capacity. Know that the SCA and Honor Society, featured at every school, and a host of other clubs and organizations determined at the school level will also be encouraged to meet. An update on middle level extracurricular activities will follow at our next board meeting. While COVID precluded last year Virginia Beach City Public Schools' long-running summer leadership workshop, the Office of Student Activities resumed the program with restricted capacity this summer, with 65 students participating, rather than the standard 130. You also notice close to 100 sponsors and coaches attended the Division Activity Advisors Conference. Tentative plans for the fall, contingent on our COVID mitigations and layering, include a second advisors conference with both elementary and middle school workshops in the fall. Will you join me at this time to welcome Dr. Kip Rogers, Academic Chief Officer.
Thank you, Dr. Soltner. Good afternoon, Chairwoman Rye, Vice Chair Melnick, school board members, and Dr. Robertson. In my last update to you, I provided our plans for how we are addressing unfinished learning with our students in the areas of curriculum instruction as well as assessment. We also talked a little bit about professional learning. So this afternoon, I will provide you with a high-level update to continue that conversation relative to how we plan to support all of our students with disabilities. Sorry about that. So with Virtual Virginia, we have 93 students who have been identified to participate in the Virtual Virginia program. 13 of those 93 students receive speech services only. Special education and related services will be provided by Virginia Beach City Public Schools special education teachers, as well as related services staff in the Virginia virtual special education setting. And that will be separate and after instruction has been provided by Virtual Virginia teachers. The Virginia Beach City Public Schools special education teachers will only serve students with disabilities, and related services will be provided by the staff who've been assigned to the students at their home schools. And although Virtual Virginia does not provide special education services, those Virtual Virginia teachers will provide accommodations as noted in the student's IEP. With Virtual Virginia Beach, and that's our internal program, the parents of an additional 53 students with disabilities selected virtual instruction. The students require services and supports that could not be met through Virtual Virginia, and in order to provide a comparable virtual program 5 days a week, VBCPS teachers and related services staff of those students' home schools or the schools where the students are administratively placed will receive instruction via the following concurrent instruction, including whole and small group, asynchronous instruction, conferencing to provide IEP goal support, remediation, and completion of tasks, as well as adapted activities that are based on IEPs in order to meet those students' needs. Special education teachers will monitor the progress of those students in the virtual setting, and IEP teams will meet regularly to discuss when a student is not progressing in the virtual setting and document those interventions that have been provided, as well as any changes to the accommodations for those students, as well as any services that may be needed. It's important to note that if a student continues to not progress, then the IEP team may make the recommendation for that student to return to face-to-face learning in order to ensure that they receive the instruction that best meets their needs. However, if a parent should refuse the option of the student returning to face-to-face, then the IEP team will certainly make adjustments to the current programming in order to address those students' needs best. The majority of our students with disabilities will be returning to school face-to-face, as you can see, including our students who are being served in our CSEP programs. And our Office of Programs for Exceptional Children, led by Dr. Ronnie Myers-Dobbs, will continue to support our teachers and staff in meeting the needs of all of our students with disabilities and the various instructional models that they need. And this work certainly has begun during our essential sessions for special education teachers this summer, which focused on using high-level leverage practices when planning and implementing what we refer to as specially designed instruction. And with that said, I will turn the remainder of the presentation back to Mr. Freeman.
Thank you, Dr. Rogers. Regarding communications from last year, we reflected on formal and informal feedback from our staff and community and intend to provide more opportunities for two-way communication this year, as well as ensuring information is getting to every stakeholder who is looking for it. We recognize the importance of sharing information related to this plan to our students, families, and staff. Last year, the plan was packaged into a document, a fairly long document. The utility of that document was challenged by its length and the difficulty with implementing and effectively communicating changes. This year, we intend to implement a more user-friendly and nimble web-based communication that will allow the user to easily navigate to the information that they need. Further, it will enable a more seamless and accessible update. That product is under development and will be shared soon. With the focus on layered prevention strategies, we also understand the importance of layered communication strategies. In addition to that tool, principals will be updated on your decision tomorrow to enable their planning. We are also considering other communication tools to support our teachers, staff, and families, including the VB Safe Together webinars that we conducted similar to last year. That concludes our recommended plan for beginning the 2021-2022 school year. This plan includes significant steps in our progression towards pre-pandemic school instruction and activities, including 5 days of in-person learning, more opportunities for extracurricular activities and athletics, and is intended to provide safe and stable start to the new year for our students, staff, and families. It follows the law and the guidance of recognized health professionals, and we look forward to getting our students back into face-to-face instruction. So with that, Dr. Jabari is joining us via Zoom. He is the Chief Deputy Commissioner for Public Health Preparedness with the Virginia Department of Health. He is also the Acting District Director for the Virginia Beach Department of Public Health. We have a tremendous partnership with his team, and we appreciate him joining us tonight. Dr. Jabari, would you like to say a few words?
Could I interject a moment? Dr. Jabari, Carolyn Rye, School Board Chair, just welcoming you on behalf of all my colleagues. So thank you for joining us today.
Pleasure to be here with you today. We're certainly focusing on the reopening strategies of the schools, and the mission of the Public Health Department is to promote health, promote wellness, and to prevent disease. And so many of the things that we have outlined tonight is really intended to do that, to ensure that our students, faculty, and staff can be back in the school buildings. Our children can receive in-person instruction, which public health personnel, educators, and our residents in the community strongly need and have said they would desire. And the conversations tonight really is ensuring that we in the public health department share with you any resources, any guidance, or any other ways that we can make sure that the recommendations provided by the school system are supported, and in case we can provide anything further to you. The reality of the COVID-19 pandemic is that it continues to evolve, certainly with the rise in cases, as Mr. Freeman noted earlier, since the beginning of July, has brought on additional urgency and concern as we look to the opening of schools. We have been on a steady increase, roughly doubling cases every week since early July, and we expect the surge to continue well into September, if not beyond. So it's with that foresight and thinking that we know, by the nature of having kids back in school, individuals in close proximity, we're likely going to see an increase in cases. We're likely going to have to respond to outbreaks. And therefore, it's really, really important for us to think about all of those layered mitigation strategies that can help potentially prevent illness in our communities. And so I have received many letters and emails from the community regarding more about the concerns of mask mandates as a whole. I know that Mr. Freeman and others have outlined the CDC recommendations for the schools. I will share again that the data is clear. Masks help prevent the transmission of the illness in many cases, or slow it down considerably. And so that remains to be an asset that we can utilize specifically for individuals that cannot yet get vaccinated. And as everyone knows, the vaccines available currently are only for 12 years and above. So our thoughts about potential transmission of illness for students that cannot get vaccinated in our elementary schools, we have to really focus on the other prevention strategies, so masking, physical distancing, making sure we have testing capability and the ability to respond for any outbreaks should they occur. But for all else who can get vaccinated, our students, as well as our faculty and staff, it's of the utmost importance that we ensure they do. If those individuals that are seeking to get a 2-dose vaccination, either Pfizer or Moderna, they need to get started right away to ensure they have immunity at the beginning of the school year. And so our work with the school system throughout the summer has been to plan for the fall. We have had multiple efforts regarding vaccinations at the end of the school year, as well as in July and following up with this month to ensure we extend those opportunities. Our community vaccination efforts at the Military Circle Mall, which are open to the entire public, including those visiting the Virginia Beach area, continue Tuesdays 2 to 6 p.m., Thursdays 10 to 2, and this coming month we'll have some other back to school immunization efforts for Norfolk, really trying to make a regional hub there. But for the vaccinations that will be available, while the locations in the city of Norfolk is again open to all residents of the Eastern Region, Hampton Roads, and really the state and beyond. So we encourage anybody that has been having a hard time with the registration, that have found it challenging to get a vaccination, to just simply show up. We will be able to provide you vaccinations within the hours noted. So vaccinations, masking, and all the other layered strategies that have been discussed, testing, as well as efficient and timely contact tracing, are ways that we can help prevent additional morbidity and illness in our schools. But we need to be prepared as our cases continue, both in Virginia Beach, through the Commonwealth and the nation, and the potential possibility of other variants along the way, for us to really implement all of those layered strategies as effectively as possible so our children can in fact stay in schools and benefit from in-person instruction. Again, I'm here at your service, happy to answer any questions or concerns, and appreciate your time. Thank you.
And as a reminder, Dr. Jabari will be joining us for the workshop. He won't be available at a later time, so this is a good opportunity for questions for Dr. Jabari.
And what we'll do is, knowing his time limitation, we'll go with one question, go around, and then if there's time after that. So if you'd kindly begin with one question. So we are starting with Mrs. Holtz.
I wanted to ask a question about the school plan. You said that the the kids with disabilities or on IEPs will also have concurrent instruction. Does that mean,
Excuse me a moment, Mrs. Holst, I didn't make it clear. These are questions specifically for Dr.
okay,
Jabari.
I'll hold them, thank you.
Okay, anything for him, the doctor right now?
No.
Okay.
Mrs. Manning. Dr. Jabari, just a quick question for you about the symptomatic cases that we're seeing right now. What are the typical symptoms of the people?
Sure. While we have a new variant, it's very much like what we have seen before. Again, fever, cough. Some people have chest congestion. One thing I'll note is that we're also seeing an increase in the number of cases of RSV, respiratory syncytial virus, which is another cold virus. So we are seeing an uptick of that, and trying to differentiate between whether it's RSV, COVID, or if we see flu is going to be difficult. But a lot of the same signs and symptoms of other upper respiratory infections. And certainly in children, where testing becomes important, contact tracing, is they may be very mildly symptomatic or almost asymptomatic. So it's important to note that when it comes to COVID, individuals may be infected, not really display any symptoms, and still be able to spread it to loved ones in their home or in the school setting.
So, I'm sure, sorry, I didn't understand the statement about the RSV increase and having a difficulty determining if it's the flu or COVID. Is that what I heard you say?
Yes, ma'am. I was just simply saying that the symptoms of COVID is consistent with many other upper respiratory infections. I mentioned fever, cough, fatigue, headache. They're what we call non-specific symptoms, and they are present in many other sorts of conditions as well, including RSV and flu, and letting the board know that there's other viruses currently out there that could present potentially with the same symptoms. So the idea is that the symptoms are non-specific. The way to know that you have COVID is to get tested.
Okay, thank you.
Mrs. Franklin, can you hear me?
Yes, can you hear me?
Yes, please go ahead.
Okay. Thank you, doctor. I just wanted to ask you a few questions. So I'm actually calling in today via Zoom because of, feeling under the weather. And I actually did get tested just to be sure that I was not, diagnosed with COVID, and thankfully my test came in negative. But while I was there, I was asking the tech some questions, and I just wanted to clarify and get your opinion on what he had to say. So basically, he was telling me that, one of the big things is that, of course, that this is passed through, water particles, and one of the reasons the social distancing is important is because that within 1 to 2 feet, you can certainly infect somebody else, because the water particles will go ahead and pass at that distance. However, because they're heavier than air, than within 3 feet, which is again why we discussed the 3 feet, that they will fall and no longer be as impactful. So I guess my question is, if we are in a position where we could distance by more than 3 feet or 3 feet, is there a possibility that we would be able to potentially unmask in the classroom? We've had so many questions. Unmask in the classroom, and then if they're speaking to the instructor or participating and speaking, they could mask again. Is there a possibility that we could use a combination of masking / unmasking to create an environment where they have a little bit of reprieve from masks throughout the day? Again, if we're distanced and we are not, and they're not currently speaking.
Sure. So what the tech was describing is what we call droplet transmission. So when you cough, sneeze, or even when you're talking, you're creating very small droplets that can be suspended in the air. And because there's a water component to it, they're going to be a little heavier and drop within a few feet. That's where the whole idea of the 3 feet, 6 feet distancing comes from when we're talking about social distancing, is that we know that the closer you are to somebody, mainly to their face where they're breathing and talking, the higher the chances of transmission. And so as you go out in space further away, that possibility of transmission decreases. With COVID-19, unfortunately, there is some evidence of what's called airborne transmission. So those who are beyond 3 feet and 6 feet in certain models and certain investigations in restaurants and work settings have been known to get infected. So the 3 feet, unfortunately, is not a black or white kind of a limitation, or even 6 feet. So the virus particle can actually go across the room. So as a whole, you're right. It's more likely that one becomes infected if you're within close proximity, but it is possible to infect somebody else at a greater distance. So where do we take that practical knowledge into our thinking when we do our contact tracing and contact investigation? While we say theoretically a child may, through airborne transmission, infect everyone in the room, when we go back to the close contacts and the quarantine, we're looking at that space. So we do take that into account, but when it comes to masking, that will help any sort of a transmission, whether you're talking about 2 inches, 3 feet, or well beyond. With regards to the reprieve, there's certain things that we just know in public health science, and it's been reiterated as well tonight, that the virus is spread as we talk, as we breathe in and out. And the possibility of transmission indoors is always way greater than outdoors. So we see some relaxed standards in the outdoor setting, certainly with athletics. And I would say for anyone, just anyone's personal safety at home, while we have gatherings, to have it outside, is that the chances of transmitting the virus while outdoors in an open air environment, while possible, is extremely, extremely small. So I think if we're going to think of any sorts of reprieve, is there opportunities to get our students out into the open air a little bit more, for recess, for education, for lunch, anything that makes logistical and appropriate educational sense within each school can be considered. That's the one thing that I would feel fairly comfortable sharing tonight, to say that you can always reduce your chances of exposure by going outdoors. But unfortunately, given that the Delta variant is so transmissible, and given that the virus can travel beyond 3 feet, the recommendations of the CDC, I think, are valid and should stand with regards to indoor masking of all students, staff, and visitors.
Okay, Ms. Owens.
Thank you. Dr. Jabari, this is Jessica Owens. I just had a couple of questions about the recommended implementation screen that we looked at. It talks about contact tracing and quarantining and isolation. And I just wanted to make sure that I had the clarity of when this applies.
Can you tell us the page?
Sure. This is on page, it looks like slide 11 from our presentation. And I believe Dr. Freeman explained that student A, if they're infected, but they're masked, and student B is also masked between 3 and 6 feet, student B would not need to quarantine. And then the next bullet says asymptomatic, fully vaccinated individuals are not required to quarantine. And I just wanted to make sure I understood, is that people who were exposed and they're fully vaccinated and they're asymptomatic are not required to quarantine, or if you are positive and asymptomatic but vaccinated, that you are not required to quarantine?
It's the exposed. If you wind up being positive, you still need to be quarantined, but it's exposed. So that's one additional value of ensuring our students are vaccinated as well, because we're not unnecessarily quarantining them when they get exposed. So if student A has illness and you got all the other ones in the class who are vaccinated, then nobody actually has to be quarantined unless they show symptoms. So that, what you were referring to, I believe, is the exposed.
Okay, thank you. And then the 3 to 6 feet part, I know that we are shooting for that when practicable, but I also know that our classrooms don't always leave the ability to do that. So anything within 3 feet, we are saying then masked or unmasked, all of those students would need to quarantine?
You know, I think best practice is 6 feet, and we dropped it to 3 feet, realizing that in just about most school settings across Virginia, it would be very hard to have students spread out logistically, so we dropped it to 3. You know, I think any less than that is a really small amount of space. You know, we would encourage you to stay within those guidelines where possible, and should an event arise, there's more questions that our contact investigators and contact tracers can ask regarding the duration of exposure, again, vaccination history, and try to advise each individual on a case-by-case basis. So just to acknowledge again that we realized it would be almost impossible to have students 6 feet apart at all times. So we've already reduced that recommendation to 3. I think if we go beneath that, we would be a little bit hard pressed to consider, you know, a safe distance.
Sure, thank you.
Can I do a quick clarification just
Yes,
based
please.
on the way you asked the question?
Mhm.
And you may not have meant to say it this way, but I want to, for clarity for everybody who's
Yep.
listening, you mentioned that, hey, if the seats happen to be less than 3 feet apart, then
Correct.
everybody would need to quarantine.
Everybody in the, within.
I think for clarity, Dr. Spence, what we mean there is only those that were identified to be within 3 feet for greater than 15 minutes in a 24-hour period would be required to quarantine, not the entire classroom. Do I have that correct?
Yes.
Thank you.
Thank you for that. And so it does sound like, based on that, the contact tracing though would contact the students who were in that 6-foot range, because they would need to find out about the vaccination status, or at least attempt to make contact with those families, because we won't know offhand who's vaccinated and not vaccinated as far as who may need isolate and quarantine, correct?
Yes, that will be important, as well as the assumption here is that they're wearing a mask, because that can also help prevent unnecessary quarantine.
Gotcha. Thank you.
That's Jennifer's hand. I think it's still Mrs. Franklin's hand up. Mrs. Franklin, did you have a follow-up? Your hand is still raised. We were, no, okay, all right. Anyone else we haven't heard from?
Yeah.
Dr. Jabari, please don't answer the question in the chat.
Okay, that's good.
All right, it looks like that's it from this end. We, oh,
Go ahead.
are you?
No.
All right, we thank you very much.
Carolyn Williams.
Okay, Mrs. Weems, here we go. Stay with us another moment, Dr. Jabari.
Yes, thank you. Thank you, Doctor. So, you said earlier that it is hard to sometimes tell the difference between RSV and the flu and COVID for children. Is that correct?
I think the point there that I made was just based on symptoms of having upper respiratory. There's certainly different constellation of symptoms for each. I just wanted to make a reminder that if someone has headache, fevers, cough, we shouldn't just assume COVID. There could be other pathogens that would be responsible for that illness as well.
Okay, thank you. And when, we've talked and we've gotten so many emails about the mental health of our students, the anxiety level, especially when you're talking about a group of people that are not nearly as affected by this virus. So therefore, they're not going to have they're not going to suffer as much as others, nor are they going to be able to benefit as others because they don't get the disease like the other population. So we've gotten many emails, and I share and parents' frustrations and concern that their children are wearing masks that are impeding their ability to learn as they should and could, and it's also causing anxiety. And so how do you answer that? Because I know just today, earlier, I was talking to a parent who had to call 26 different places to be able to get her child to see a therapist. And it was based on anxiety and masks and being afraid that they were going to die, you know, et cetera, et cetera. So how do you balance that out?
I think that's a really, really good question. So, you know, anytime we make broad public health policy and statements, it's intended to protect the greater good, the greater population. But we know for certain individuals, as the example you just provided, those policies aren't applicable. I think this is why the response to the pandemic has been so hard on the local level, state, and the federal level, and even beyond, is that, again, public health is in the practice of doing the greatest good for the greatest number of people. And that may mean, you know, asking those to get masked, certainly no mandates for vaccination, but we're encouraging that. It's the idea is to, you know, look at it from a societal perspective. But we clearly realize for certain individuals, students, certainly families, there may be other very difficult considerations for them to have to address. So I acknowledge it. I'm not sure if I have the right answer or the best answer for each an individual case, but just simply that, you know, those kinds of conditions, really, we want to make sure that the mom or the parent is in communications with the child's healthcare provider, is talking with the school to see what kinds of accommodations, if any, can be made, and to really, you know, treat each individual case on its own merit. So let me just acknowledge again, it's hard whenever you make policy to fulfill everyone's expectations 100%. But what we're looking at is a population health approach, what's again in the best interest of the entire community at large.
Yeah, but yes, but it just seems that the population of 4-year-olds to 17-year-olds are once again shouldering the burdens of keeping others healthy when the vaccine is readily available. And that to me is very problematic, especially when we know data shows, hospital shows, therapy, waiting room show that children are suffering from this, the whole COVID, the anxiety, the fast, the face masks, and our educational data shows it as well. So I just hate to see, again, children carrying the burden on this, again, going into the, you know, it's going into the second year. And from what I hear from you, there could be an upswing, another variant, another one next year, another one, you know, are we going to be masking these kids forever is I'm sure the concern of many parents out there.
Anything else, Mrs. Weems?
No, that's all. Thank you. Thank you, Doctor.
And there'll be a chance again. And Miss Owens has one follow-up, and
Yep.
we're keeping.
Just one quick one. When discussing the layered prevention strategies that localities should be looking at, our slide talks about monitoring community transmission and vaccination coverage and occurrence of outbreaks. It also mentions screening testing. I was wondering if you have any comments on screening testing, the use of that, how that should be happening, or if that should be happening, and if our school staff can weigh in on if that's something that we are considering at all.
We did talk about this with the school staff just earlier this week. I think we're both on the same page, so I'll defer to Mr. Freeman or others to discuss, and then I'm happy to add some additional comments as we talked about this for various levels of need, episodic, surveillance, athletic teams. So I'll defer to the school leaders, and then I'm happy to add in further thought.
Substantial discussions, continued ongoing discussions with the Virginia Beach Department of Public Health on this topic. And our current evaluation of this is it doesn't provide a substantial improvement to our layered mitigation strategy given all of the additional overhead and requirements on the program. I'll call that the top level, the high level. Now that being said, we continue to evaluate as we move into this. We are constantly evaluating what is the best tool in our toolkit to be able to implement, to be able to handle any problem we have. So from a screening testing, If we have specific outbreaks in schools, we had the conversation with Virginia Beach Department of Public Health to look very closely and put all tools and resources that we have available to be able to address those specific needs. We've also had discussions about the potential for other programs that are at higher risk of implementing those. Those still haven't met the level where it's going to provide enough good to implement that layer, but that's the high level. So Heidi Sawala is our coordinator for health services. Did I capture that fairly, Heidi?
Yes, exactly. The surveillance testing has quite a bit of complications with it, and that also that it would cause a lot of stress to the children if you're subjecting them to routine testing, every week. We would want to consider that they're already under a lot of stress coming back to school. We are exploring the possibility for doing some surveillance testing with the athletic program, and that's just an exploratory point at this time.
Thank you.
Okay, so Dr. Jabari, I think we're ready to let you go, and we thank you again for your time with us today.
In the area. It is an unknown entity. There are new variants. We don't know what the long-term impacts of this illness, whether in the young or the elderly. So doing what we can to prevent the transmission, whether in the schools or in the outside community, is going to be a continued priority for the Virginia Beach Department of Public Health. But we're certainly here talking very frequently with the school system. Again, appreciate all their support for the back to school immunization efforts. And if our cases continue to increase, we'll bring additional resources to bear for after school vaccinations or testing as needed. Thank you again for having me tonight.
So we do have two more workshop items, and my suggestion is that we will continue this discussion when we get to the action item in the formal meeting. Is that agreeable to everybody? Okay, so that brings us to our human resource staffing update. Beginning with Ms. Woodhouse.
So good afternoon, Chairwoman Rye, Vice Chair Melnick, members of the school board, and Dr. Robertson. I am Cheryl Woodhouse, Chief Human Resource Officer. This afternoon, we will present the recruitment and staffing summer update on successes and challenges in both recruiting as well as our staffing. Please know we will continue to have the more detailed presentation as we traditionally presented during the month of December. This afternoon, Ms. Ann Glenn Zelznick, Coordinator of Recruitment and Retention, will present the presentation. Know that we both will be available at the end to address any questions you may have. Thank you.
Good afternoon. Our agenda for today's presentation includes challenges related to the supply and demand for teachers and staff, Virginia's critical teacher shortage areas, along with a brief overview of the causes for the teacher shortage. In addition to this information, we will also review our staffing results. Finally, we will provide an overview of our new recruitment strategies. Along with the other goals, the Human Resources Department especially supports Goal 4 of the Compass of 2025 strategic plan. We are always in search of high-quality applicants, and our hiring managers also support this goal. Now let's take a look at the market conditions across the nation and Commonwealth. There continues to be a teacher shortage. Student enrollment in teacher preparation programs is low. This is especially true for students of color as well as male students. Therefore, the overall number of qualified applicants to fill our critical shortages in areas such as secondary math, special education impacts the division and the state. Finally, the retention of teachers is also a challenge. You may recall from previous school board workshops that we showed you this graph. The national shortage continues to be impacting divisions and districts across the country. The blue line in the graph represents the supply of available teachers, and the black line represents the demand for teachers. The arrows show our current situation in 2021. The pandemic has further strained an already faltering pipeline of qualified teachers. In Virginia Beach, we are resilient in our efforts to meet this demand to support our schools and students. The supply and demand across the country is impacting the state's ability to obtain teachers too. The Virginia Department of Education provides information about the critical shortage teaching endorsement areas. Special education, elementary, pre-K to 6, middle school education, secondary math including Algebra 1, as well as career and technical education are the top critical shortage areas. As we review the national and state supply and demand for staff from a number of sources, there are additional causes for teacher and staff shortages that are impacting the market conditions. The lack of qualified applicants to fill critical shortage vacancies, better compensation packages, benefits, and salaries offered in other districts, along with applicants simply choosing other careers that offer better benefits and/or a higher salary. Finally, fewer students are graduating from teacher preparation programs, and teachers are selecting to leave the teaching profession for other opportunities. Although we have these challenges, we continue to strive to fill vacant positions with qualified staff. As of August 5th, we have filled 1,187 instructional and non-instructional vacancies. This would have not been possible without the teamwork between principals and other hiring managers, the Department of Human Resources, and the support of our school board. Our work needs to continue so that we can fill all positions. As of August 5th, we have 155 instructional vacancies listed at the elementary, middle, and high school levels. These align with the VDOE's critical shortages list mentioned in the previous slide, with the exception of English. Please also take note of our need for school psychologists and speech-language pathologists. Keep in mind, this is not a comprehensive list of vacancies, but merely a representation of the vacancies in no specific order. There are 403 non-instructional vacancies related to bus drivers and custodians, bus drivers, custodians, and cafeteria assistants remain as one of our highest areas of need. Of course, our paraprofessionals are also equally as important to support the pre-K program, kindergarten, and our special education students. Again, this is not a comprehensive list of vacancies, but merely a representation of the vacancies in no specific order. So what are some of the new strategies we have incorporated this year to enhance our efforts to locate and identify qualified staff? As you can see on the slide, we are utilizing our distribution vans as mobile billboards to promote information about employment opportunities in the division. The first wrapped van made its debut during a Human Resources Department pop-up event in the spring at Pembroke Mall and was displayed this week at the VBCPS Back to School Care Fair. Of course, we actively participated in virtual job fairs inside and outside the state of Virginia. Our educational reach enables the Human Resources Department to continue to maintain relationships with our local universities and colleges to support student teachers and school counseling interns. They are also able to become substitutes with us throughout the year. Also, we recently began collaborating with Centura College to assist with their development of their paraprofessional program. Our Grow Your Own programs continue to thrive. The VBCPS Future Teacher Award program gained 24 new recipients this year who will be eligible to become a part of the VBCPS team once they successfully complete a teacher preparation program. In addition to this program, we also continue to support programs like the Teacher in Residence program and Try-It programs at ODU, and the Fellows program at UVA. Our social media outlets and job search engines such as Indeed and Glassdoor provide information to a wide range of applicants, as well as our job postings at vbschools.com. Our Retiree Opportunity Program is in its third year of operation and is another staffing resource that enables us to reach out to retirees with information about employment opportunities with VBCPS. While retirees can support us in many ways, a retiree may be eligible under certain conditions to fill critical shortage areas if they meet the VRS requirements. This could potentially enable the retiree to receive both a full-time salary and their full retirement pay. To be eligible, the retiree must hold an active license, have a break in service for 1 full year after retiring. Included in the critical shortage areas are retired bus drivers and retired law enforcement officers. Specifically, law enforcement officers and bus drivers from Virginia. How can we all support recruitment? I'm gonna let that mull just a second. Follow the VBCPS social media outlets that provide a wealth of information about your division and employment opportunities. So what we're saying is repost our post. Share the good news. We have amazing blogs. I think Natalie is here somewhere over there. Her team does an amazing job at sharing information as well. Our division has excellent educational opportunities for students, as well as the way to celebrate the great work our staff does every day. We need to elevate and promote the field of education and consider that all of us had teachers and support staff who assisted us through our own educational journeys. As we conclude our summer staffing update, as of August 5th, We will continue to work diligently to staff our schools for September. Staff of the Human Resource Department are available for any questions that you may have.
We'll start with Ms. Owens.
Thank you. Thank you for this presentation. I just have a couple of questions to understand kind of how our current situation compares to where we've been in the past this time of year, and also in the achievements section, over 1,000 vacancies filled is amazing. It says as of August 5th, and I know that that's a continued thing. What is the start date that we started counting for those 1,000? Is that from like last September to now, or when are we looking at?
So we start really when we have our meet and greet, not a meet and greet, when we open up everything to, I say the world, but we start with our in-house and our internal placements. So we're talking really from June, I would say June 30th. Maybe I'm not saying the right date. Sorry,
We start hiring back in April and May.
Okay, so this 1,100 hirees is from like April to August?
Now, yes.
Right. So we have our meet and greet first, which is our in-house stuff, and then it opens up. When I say opens up to the world, then everyone else is eligible once those applicants or once those employees are placed.
Okay. And this time last year, I kind of roundabout, can you tell us how we compared, or
I'd have to look up that.
Okay.
We can get that to you.
Although, let me step in, although we don't have the specific numbers, we do have more vacancies at this time as we did last year. Also, as we began the school year last year, we were actually not fully staffed. We were able to work closely with the Department of School Leadership, which I was actually a part of, so I can reference, as well as our building administrators to redefine some positions, make some moves with staff, and we're looking at similar strategies for the upcoming school year.
And this might be something that you have to pull the numbers and get back to me, and that's fine as well. I'd be interested just kind of to have an idea about summertime resignations. We've done a lot of hiring since April, but you know, it's a balance. I'm sure we still have people making final decisions, and so kind of how many people we've had resign since June through the summer.
Most definitely.
Thank you.
Mrs. Manning, then Mrs. Felton.
Yeah, I had the same question regarding how it compares to previous years, so if we could get those numbers, that would be great. And I just want to say kudos to you guys for all of your efforts in recruitment. You were doing a fantastic job. I don't know what more you could do. So I know it's a situation. So thank you for all that you're doing for that. I recently met someone who I believe her husband was doing the ODU Try It program. That was the first I'd heard of that. Is that different from Career Switcher? Or
It is.
can you just tell me
It
just
is.
quick a little bit about that?
So it is general education or teacher assistants who could be eligible for a special education license. So they take 5 courses.
Okay.
So there's different routes to licensure. So that's one of the program here. And then we have the ODU teacher in residency program where a teacher is working through getting their master's degree. So one is about eligibility for licensure. So there's certain courses that make you eligible. So, and then there's one that's pushing towards master's degree. And then the fellows program, which you mentioned,
So
one student.
So the Try It program, you would already have to have a degree in education.
Bachelor's degree.
It doesn't have to be in education.
No.
Oh, wow.
Because it's the alternate route to licensure.
Okay.
Requires that you have, it's on the VDOE, requires you to take a course in special education categorical IDs and law. So there's, ODU actually has one class, and a couple other universities do too. And then it makes your licensure eligible. So only alternate route for, specifically for special education.
And it's 5 classes?
So there's 2 different routes. That's the Try It.
Okay.
But if you independently go on your own and take that class right now, Then you would be eligible, if eligible for a license, you could apply for it on your own.
Okay.
And again, you would have to interview and go through the normal hiring process if someone selected you.
Okay, we need to make that more prominent because I didn't know about it.
And you can, you qualify for a provisional license, which means basically you can be given a period of time to fill any other requirements necessary, and usually that could be spread out over a 3-year period. So it's a great way for folks to transition who are interested in education. That's why I love to try it, kind of try it out.
I like that too.
And it has really helped us in terms of securing special education teachers, because if they take at least those minimum courseworks, we can start them in the classroom, assign them a teacher mentor, and support them through the 3-year provisional process.
Do you all have something on each of these programs that you could send me, or maybe send the whole board, and then we can kind of help disseminate that information?
Absolutely.
Exactly.
Thank you.
And you've raised a great question. It says that we too need to get more information out in front of our community around these other routes to
Thank you.
licensure.
Thank you.
Good, so we'll look forward to that, thank you. Mrs. Felton?
Thank you, Ms. Glenn Zilnick. I appreciate your presentation, and I'm really impressed with how we reach out to our retirees to get them to come back. I've always been impressed with that program when we had a retirement benefit, and how you're all just sitting out there recruiting them. That is a great incentive. Thank you so much. You could have answered this already, but this question's come from a lot of our volunteers or teachers aid or teacher assistants that are already in the system. They've gone through the process. And since COVID, ODU paraprofessional testing, somewhere has been a disconnect. They haven't been able to connect with them to find out how to take the test and when to take the test and who to reach out to. When I was at ODU as a employee, it was easy for me to reach out as well, but it has lost that disconnect. How do I tell them, where do we go now to get this process implemented? They want to come back to teaching on schools.
We would just have to, we have to just connect with them. Typically, they can actually take the assessment on their own through Praxis, but what I'm hearing you say is that just to have I don't want to say a class, but a scheduled time maybe within the division to schedule that. Sure.
Well, and that's what I'm saying to you. ODU has literally, it has not been any kind of connection there. The center there, the hours are off, and no one knows how to get in touch with them. So that whole department has reassembled themselves. So I'm asking you if you could, what we need to tell those individuals who to reach out to now at ODU. ODU is doing great work when it comes to teachers. Always appreciate what they're doing and getting them here. So if we could keep it the partnership, we really want to. Thank you so much.
Through our collaborations, we'll reach out to them and make sure that we're providing the best service on our end as they are on their side.
So as they reach out to me, Ms. Glenn Zilnick, can I give them your?
Sure, absolutely.
Thank you.
So I'm going to take this opportunity, going back to market conditions and going back further to our retreat. It came up in governance committee when we were discussing retreat, assessing the retreat. And Dr. Spence took the opportunity at that point to share that on the city side, we're not sure at what stage, but they're going to be putting out an RFP for a market study. And so our plan was to come back here and as part of this workshop discussion, he's looking for some input and we're looking for input from the full board on what your reaction to that. It would obviously involve us reaching out to the consultant and with respect to the compensation philosophy, right? We're in the midst of that. So we would want to align everything and not work at cross purposes. Maybe I can ask Mrs. Linetti, who was also at the meeting, to weigh in a little further.
It's my understanding that the city has, in the process of sending out an RFP to see what it would cost to do a compensation study. The RFP also included requests to provide information about including the schools in this. So that if that goes out, that's a possibility. It could either be that this whole study both the city and the schools, or they could do a separate one for schools, but it's potentially being sent out so you would get some information. if you had to go out with an RFP, it would take you a little bit longer to develop it, get it out on the street. What Dr. Spence is mentioning is that there is currently an RFP that's been drafted. If you're interested, you can reach out to the city manager's office and say, hey, we would like to participate and know more about it. It might save you some time, potentially some money if you're combining them together for it. It doesn't have to be done, but it's somewhat of a cooperative procurement opportunity. And knowing that, and the way it came up in governance was as a follow-up of the retreat, what more do you want the school administration to do about your compensation philosophy? Dr. Spence mentioned in a different meeting he had met with the city manager's staff, he was aware of this. Is this something you're interested in? Because that will go on the street in the next couple of weeks. If that is something you're interested in, then he needs some direction to go talk to the city manager's office.
And if I could provide an update, I've actually had communications with the city. They were looking to expedite their timeline in terms of their work with their consultant. So at this time, we had declined to participate with them because they were doing a full division study, and we were still working at that time with the board on your compensation philosophy. We also had shared with the city that when we look at our compensation packet as a group, the concerns that are typically addressed are around benefits. So we're working with our benefits office and with staff that we already have in terms of doing a comprehensive study around our benefits. So because we have been able to do in-house compensation studies and bring them to you at a much more reduced cost and not to be rushed or hold up the city, we declined and opted to go in the direction of let's focus on our benefits packet, because I don't know if you all recall from our December presentations, we always ranked pretty high in terms of our salary, but in the 757 area, not so high, usually last place or next to last in our benefits. So how could we focus a little bit more on that area? And in terms of when we are making job offers, what we typically hear more from our candidates is the benefits are more concerning, whereas not necessarily the salary. But we do know they go hand in hand. So not to hold up the city because they were ready to sign and move forward, we asked if they would send us some information. And if we choose to go in that route, maybe we can better fine tune what it was, because at this point we weren't looking for to expand across all job codes.
And just further clarification, at the same time Dr. Spence asked you to engage the board, he asked us to engage with Human Resources to get their recommendation, and their recommendation from Cheryl, John Mira, and Farrell Hunsacker, Crystal Pate was to decline that avenue. However, if the board has a different decision that you would like us to make, then of course we can do what needs to be done.
Mrs. Manning? Just on that topic, I know that we did have this discussion during budget season last year, and one of my biggest questions was, what about non-instructional comparisons? And we didn't have that, and so that's particularly what I was hoping for in a study like this: is how do we compete in the salaries and the benefits package? I'm fine with that, but in the salaries in those non-instructional positions. So if we could, I would suggest that we still try to look into that.
And we still have the consultant as another possible route for that. I mean, Dr. Spence did say part of, and if we don't do it now, it doesn't mean we can't reconsider it later, right? But you remind me that he said one of the purposes of such a study would be to and my other colleagues who were there can affirm this, would be to affirm what these markets are different, right? Teacher markets, are we talking local, state, national? And he went down the pike with all our different non-instructional categories too, and that's part of what this sort of thing would offer, this sort of study would offer.
Right, and that's why I was just thinking that if we partnered with the city, because they have a lot of the same types of positions that we would have non-instructional. So if we partnered with them, it sounds like it would probably cost a lot less than if we did it on our own, a separate study. So I would be interested in what the numbers would look like. Comparisons.
And again, at the time that I spoke with the city, which was last week, they were signing their
So it's too late.
contract. I wouldn't say it's too late. I would probably say there's a possibility where we can see how we can still capitalize on a partnership, meaning their referral to us. At the time, again, we were such in the early stages of the compensation philosophy, what exactly the board would want us to study, and because they were pressed for time, that was the initial reason why we had to decline. And so I'm hearing what you're saying and would love to hear what everyone else is saying, and then we could work to best bring a proposal to you, working with other departments before we even put an RFP out there.
Okay.
Mrs. Franklin's hand was raised.
Mrs. Franklin.
Yes, thank you. Well, first of all, I just again want to congratulate Dr. Nesbitt because he has a great job to your team.
I also agree that benefits is a huge attraction for some of those positions. And as I had already let Ms. Woodhouse know, there are over 750 service members exiting the military per week. And so in this particular area, so I would really like to figure out if we can align those things. And I know that I've already been emailing Ms. Woodhouse all week, so I apologize, Ms. Woodhouse, but I would like to figure out, is there a way to do a fast track? For example, I know that some of the community colleges here locally will give military credit or credits for military service, particularly if they already have, let's just say, an instructor's license, or if they are currently a linguist and could help with some of the, with some of the foreign studies and that sort of thing. Just that way we could help fill some of these positions, whether they come in as maybe a TA or something. I love this Try It program. Is there a way realistically that we could utilize some of the experience that these service members have? It gives them an opportunity to find a job. It gives us the opportunity to fill some needed positions. Is there a way to possibly put something like that together where we could create a fast track program for the military?
So this is Ann Glenn Zelsnack. So the universities take the lead on those programs, and they work with the higher education, or the VDOE, and of course the state accreditation for higher education for these programs. So it would be, in terms of a degree program or certification or eligibility, some of that could come through an alternate route, like career switchers, depending on what their degree is, if they have a degree. So the years of service and some of those things are not always equitable. It might be interesting to see how the military presents that information, sort of in, I would say, layman's terms, right? So how does it equate from this military experience into a collegiate accredited verification? And that's the disconnect, I think, a little bit.
And Ms. Franklin, first and foremost, any questions you have, please contact me at any time. We are actually very excited to look for more opportunities to partner with our military. I know, being a former military spouse, I think in terms when my husband was transitioning out, and I say my husband, I say the family was transitioning out, I think there are opportunities where we can partner with the military, that when they're hosting sessions around job employment and different opportunities, that we too can be at the table and do a presentation similar to what we did tonight, but more around what's available in the educational setting. As Ann mentioned, which is true, there's different paths to licensure, and so we could definitely expose the entire military family, because as the one spouse is partnering out, employment opportunities for the other spouse is just as valuable. I know for us, we were relocating back from out of the area to home, and so I too equally was looking for employment. So I love that you reached out to Mr. Freeman and I'm excited and look to enhance those opportunities. And what I love is because Mr. Freeman does have some contacts as well as you, that we can reach out to those individuals and see how we can build an even greater partnership. So thank you.
So if I may offer a suggestion,
Yes, thank you.
So I was gonna offer a suggestion that outside of this meeting, maybe school board leadership could follow up with you all, and we could just reach out one more time to city council. If definitely it's too late, we at least keep that in mind while we enable this internal process to go forward and continue to assess. How does that sound,
Most
everybody?
definitely.
Okay. Thank you.
Thank you.
Thanks.
So Mrs. Linetti is willing to get started on this session, and we'll see how much we can get through in the remaining moments here.
We're not gonna do this at Camby Street, we're gonna do it.
So as a reminder, we're just kind of a step-by-step process on, gathering more information with respect to the issue of collective bargaining, and today is legal aspects.
Are we gonna have a hard stop at 5:30 or?
We'll see where we're at.
Okay.
Good afternoon, Madam Chair, Vice Chair, school board members, and Dr. Robertson. I'm Cammie Linetti, School Board Legal Counsel. What I'm going to be presenting to you today, or at least introducing to you, is a follow-on to what Mr. Muir and staff presented to you at the school board retreat. I believe in April, when I started discussing with you some of the issues involved with beginning a collective bargaining process in Virginia Beach, one of the things we were talking about was how you had to go about and develop a process. Right now in Virginia, there is no set process out there. What they've said is you're allowed to begin collective bargaining, but you get to decide the rules, and there's just a couple rules that they have in there for you. So what we would have to do if you decide to do collective bargaining is we would have to create a system, and a system is a process. It involves definitions, it involves procedures, it involves timeframes on there. There are not, right now in Virginia, very many examples of this. The best one I can see at the moment is Arlington County, but Arlington County is dealing with county employees, so some of the issues are a little bit different. So what we decided to do when we began presenting to you issues with what collective bargaining is, we started with Mr. Muir to explain to you what you are already doing on there and what you would have to do. A lot of collective bargaining agreements or memorandums of understanding actually incorporate many of the things that you already have in place. In fact, an MOU often looks like a policies and procedures manual. You already have very extensive policies and procedures that you have. You already have things in place. So the question would be, what are you going to do with what's in place versus what you're going to have with an MOU? So the decision at the retreat was to introduce to you, what are you currently doing? What are the procedures you have on there? And do you need to have a different process? What I'm going to start explaining to you tonight are some of the things you would have to look at and design for a process and procedure. And it would actually be a long document usually that we put in place, not quite like policies and procedures, but a very long explanation of what you would adopt. Again, what decisions you have to make, what starts with collective bargaining. As mentioned, as of May 1st of this year, you are now have the opportunity to either entertain a resolution of your own, you would create a procedure that you wanted to do, or what could also trigger it under the current law is if a petition is submitted to you by a majority of employees that have self-declared themselves as a bargaining unit. If they send something to you saying, we would like you to recognize us as a bargaining unit and to establish an exclusive bargaining agent on behalf of this unit, you then are triggered on another process by the current statute, which says you have 120 days to decide whether you're going to accept their petition and recognize them to that. If you do that, you are going to have to make a whole series of decisions. So the disadvantage of not having a resolution already in place is it could trigger 120 days to make some of the decisions that I'm going to start explaining to you tonight. And after that, then you would have to make a decision as to this particular unit or bargaining agent that came in. Did they meet the criteria? The difficulty with not having a resolution in place is that whatever they put in might then not meet what you want requirements. You will have to make a decision for that, or you're going to have to disqualify them and then develop a process. Either way, you're going to be triggering that particular time period. It's a short time period. Now, what I want you to do tonight is not necessarily make the decisions. I want you to think about what kind of questions you have and what you would have to do. And what we explained to you before, there's a lot of work involved in that. Again, as mentioned, you have to develop these procedures on there. All right, so what do you have to have in a collective bargaining agreement? This isn't everything. This is just some basics. You will have definitions. things like, what is a bargaining unit? What is an exclusive bargaining unit? What does it mean to be an agreement? What does it mean to certify a group? What does it mean to decertify a group? What do you do as an impasse procedure? All those things have specific means that you would have to develop. One of the biggest areas you're going to have to deal with is establishing an employee bargaining unit. What are you going to define as an employee bargaining unit? Who can participate in that? Who's going to figure out what the employees that qualify for that? How are we going to design that? I'll talk to you a little bit more about that. Then you have to verify those employees that are in there. So let's say you decided you're going to have all teachers in there. Who are the teachers on there? What's the process? So if somebody came forward and said, I want to represent all the teachers in Virginia Beach, again, how are you going to go verify that everybody on their list is somebody who's an employee that meets the criteria of a teacher? There are procedures you have to follow. Then you have to certify the bargaining unit. Again, as I mentioned, they could set in a petition for you to certify them, or you can establish a procedure. What are the procedures? What do we have to show you to be able to define ourselves as a bargaining unit? What are you going to ask for? All that is something you're going to have to develop. Procedure for public notice. Once somebody comes forward or a group comes forward as a bargaining unit, what do you have to do? In most cases, you have to put out public notice. We received this request to represent all the teachers in Virginia Beach Public Schools. You have this amount of time to respond. This is how you respond. This is the time period. You might have to have a public meeting on that, a public hearing on that. You may then have to look for other information. What that also triggers a lot of times when that happens is other groups say, oh, well, they want to be the teacher's representative, we want to represent the teachers. So then you might have another group coming in, which may trigger another time period. So we would have to define what the time periods are, what the information is you want to see. Procedures for voting on exclusive bargaining agents. As I mentioned, you come in and say, I want to be recognized as a bargaining unit. Let's say I want to represent all teachers in Virginia Beach. That is one certification process, but then you have to establish one entity or person who will represent those individuals during the collective bargaining process. So first you establish the group, and then you say, okay group, this is now all the teachers in Virginia Beach. This entity wants to be your exclusive bargaining agent, and there's a way that they have to go through a process to elect them or certify somebody. And again, there's an election procedure you have to do. We would have to define what that is going to be, how long it's going to take. Let's say you've established a group and you've now certified that group, and they say, we don't like this agent that we've elected, we want to get rid of this agent. There's a similar decertification process and an ability to elect somebody else. We have to define what that is. These things do not currently exist in the law. We would have to create them. There are examples out there that we could use, but again, you get to define it and know what that is. And then you also have to talk about what kind of things are you willing to negotiate. That's a lot of what Mr. Mira was already talking to you about at the retreat. These are the things you already have in place. What more do you want to be able to negotiate with them? So just an idea, again, starting with what rights you have. The way we talk about this in collective bargaining is they're mandatory things. Your MOU would say these are the things you absolutely will talk about every single year with this bargaining group. A lot of times that's wages and fringe benefits, hours, terms, conditions of employment, how long you can, what things have to be in a contract, things you already have established, and sometimes that gets put into an MOU, or you can say you don't want that. Any matter relating to bargaining and employees, their employment services, those are the types of things you tend to see as mandatory, but again, it's not currently defined in Virginia law. You would be able to choose that. Also, there are permissive things. You may talk about certain things, leave time, coming off, uniforms, things like that may not necessarily be in there. Those are typical things you might see in a permissive area. There are also certain things that we're going to say in an agreement you tend to call them illegal, or things that you will not discuss on there. Again, what we'll talk about, what are you going to bargain for? There are certain things that are rights are reserved to management. These are non-negotiable rights. You absolutely want that in here. The best example I can give you would be when you look at your grievance procedure, there are certain things that are always reserved to management. We can't negotiate those rights. And I will tell you, one of the legal problems we're having right now in Virginia is the fact that by the Constitution of Virginia, the right to run the school board is given through the Constitution of Virginia, Section 8, Article 8, Section 7 of the Virginia Constitution. The school board has the right to do that. The question right now is whether this new collective bargaining law will authorize you to give away those rights. And that's going to be a problem we're going to probably have to establish in the next couple of years. So we're going to be very careful in anything you bargain that you don't give away your rights to exclusively manage the school division. Again, there are other things that you talk about, what is the school board interested in discussing, you can think about that, say, hey, we'd like to hear more about this. So we're in a collective bargaining, we might want to hear more about, what do you think about leave? What do you think about spring break? Something like that. You can define those things. And there's other things that you may, things that you want to consider but may not decide include. So you may say, we're not going to negotiate this, but we'd be interested to hear, do you have any other ideas that we don't know about? Again, those are all things we would define in an MOU, so you need to start thinking about those types of issues if this is something an area you want to go. What are the type of things that are reserved to management? This is pretty standard issues coming in there. You determine matters that are inherently management policy, but not limited to the following types of things, like the functions and programs of the school board, the standards of service, the overall school board budget, utilizing technology, organizational structure. Those are all the kind of directing, supervising, evaluating, or hiring employees. Those are all things that just tend to be standard management issues. Again, maintain, improve the efficiency and effectiveness of government operations, determine overall methods, suspending, disciplining, demoting, discharging. Remember, in Virginia, you have a very comprehensive grievance process already in place for teachers. We have our own internal process for non-teacher folks. We're not quite sure of the law in Virginia how much you can take away that grievance process. There are people right now that are suggesting that you can set up a different set of grievance rights than what's already in the code and the regulations. We're not sure that that's actually true. So that's an area that's developing the law. There's other things we talk about. And again, these are standard management things, but you can decide whether you want to do these things or we would put in the agreement. These are the following things you cannot discuss. We will not discuss this with you. There's the subjects in there, you know, the extent of the subject logic, these are the things we've been looking at. Extent that the subject logically and reasonably related to wage and hours. This is a little bit of a messy area in collective bargaining because in many ways, everything goes back to the conditions of work or salary, which might be things that we wouldn't negotiate. So you would have to kind of parse out among yourselves, what are you willing to negotiate and give away, and what kind of things else do you want to talk about. It's also mediation and impasse resolution. What happens when you have sat down to the table with this group and you can't come to a resolution as how you're going to do it? You also then have to develop a process for that. Now, Madam Chair, I'm going to stop because it's 5:31.
And my suggestion is that we add this to the next workshop, that this is so that we can recap and finish this, and then you'll have the opportunity to consider this in the next 2 weeks and come back. And I thank you for introducing, just thought it would be a good use of the 10 minutes. Okay, so we will, the workshop is adjourned and we'll convene at 6 o'clock in chambers.